Hello, I'm going to say about the inguinal canal today. So, first of all, what is the inguinal canal? It is a musculo-aponeurotic tunnel which is about 4 centimeter in length, and you have to know where it lies. It extends from the deep inguinal ring to the superficial inguinal ring. Okay, first concept, you have to know where it lies and where it extends and what is it actually. First of all, we have to know the inguinal ligament, which is the aponeurotic part of the external oblique muscles, which is extend from the anterior superior iliac spine to the pubic tubercle. Okay, and what happened? Actually, these muscles, when it coming downward, forward, and medially, these external oblique muscles. In this area, in the anterior superior iliac spine of pubic tubercle, it become aponeurotic and it become folded posteriorly. Suppose these are coming this way, so it will fold it posteriorly. This way it will fold it. Again, it's become more folded because of the traction from the fascia lata, which is the deep fascia of the thigh, and which give traction from the lower part. Okay, so downward traction. So that's why it's become a groove part, and this way, actually, the inguinal canal forms in this area. So that's why also the direction of the canal is downward, forward, and medially. Before knowing the inguinal canal, we have to know this part. We have to identify, we have to go the idea. So in the middle part there will be the pubic symphysis. So this side, another side, this side is another side. This is the pubic symphysis in the midline. Just this way, in this area, this part will be known as the pubic crest. Just lateral to the pubic crest is the pubic tubercle. So from the pubic tubercle, the inguinal ligament extends laterally. Now we should know about the extension of the inguinal canal. You know, this extends from the deep inguinal ring to the superficial inguinal ring. To this part, this one is the part I have already mentioned. This part is known as pubic crest. So just over the pubic crest there is triangular opening, and which are formed by actually the external oblique muscles. These are two crura. In this area, just over the pubic crest, here lies the superficial inguinal ring. And where lies the deep inguinal ring? You have to know first the mid-inguinal point. Don't confuse it with the midpoint of the inguinal ligament at mid-inguinal point. Midpoint of the inguinal ligament means it's the point in the midpoint of the inguinal ligament. That means it lies in between the pubic tubercle to anterior superior iliac spine. This is the midpoint of inguinal ligament. Again, what is mid-inguinal point? Mid-inguinal point is the point in between the anterior superior iliac spine to the pubic symphysis. Don't confuse these two terms. Now, the deep inguinal ring lies about 1.25 centimeter above the mid-inguinal point. That means it lies between the anterior superior iliac spine to the pubic symphysis, not in between the anterior superior iliac spine to the pubic tubercle. Okay. So we have got that this is the point that it extends from the deep inguinal ring to the superficial inguinal ring. The deep inguinal is the oval in opening, and this one is triangular in opening. which is about from here to here, only 4 centimeter inland. Don't confuse. Don't make the concept that it extends in the entire inguinal ligament. Only it lies in the medial part, which is about 4 centimeter inland. Okay. Again, always remember one thing. This mid-inguinal point is always lies lateral to the infraepigastric artery. So during the time of dissections, always try to identify first the infraepigastric artery. Then if you get the infraepigastric artery, just lateral to try to look for this one, deep inguinal ring. Okay, so that means deep inguinal ring lies just lateral to the infraepigastric artery. Again, in the superficial inguinal ring, one thing you have to concept is that one, that its base, it's triangular in shape. Okay, so its base is formed by pubic crest. Okay, so which is apex is directed above and laterally, which is actually formed by the convergence of the two crura and kept in position by the intercrural subfibers of the external oblique muscles. So medially we can say this is the superior crus, and laterally we can say this is the inferior crus, which is over the pubic crest, we can say. That means this canal is extend from the deep inguinal ring to the superficial inguinal ring. Okay, in this area only it contains, not the entire length. But during the time of descriptions, we have to say some boundaries of the canal. Definitely it contains one anterior boundary. This way, when muscle is coming, there will be the anterior boundary, and posteriorly also there will be one boundary, posterior wall. So anterior wall, posterior wall, one will be the floor and one will be the roof. So how can we remember all these things? Which things that forms the anterior wall, posterior wall, floor, roof? Okay, before going that, one thing you have to remember, you have to understand that the first these things, before going to that, just after you knowing this, directly you can say anterior wall what, posterior wall what, all this. You should have one concept that this one is external oblique muscles that forms the groove where the actually inguinal canal lies, and from this groove part, two muscles arises. One is the just behind it internal oblique aponeurosis muscle and external oblique muscles. Sorry, internal oblique and transversus abdominis muscles from the external oblique muscles. Okay, from this group part, this internal oblique and transversus abdominis muscle not only arises from this part, they also arises from this iliac crest also. You know, this iliac crest, they have two half, dorsal part and ventral part. Again, the ventral part is it contains three lips. One is the external lip. In the external lip, the external oblique muscle inserted. In the middle intermediate lip, this one is the internal oblique, and in the innermost, this one is the transversus abdominis. This concept I think you know. Again, these two muscles, internal oblique and transversus abdominis muscle, they also arises from the posteriorly one fossa, very important fossa. This one is known as the thoracodorsal fossa. From the thoracodorsal fossa also they arises. But from where for these muscles, this internal oblique muscle and transversus abdominis muscle, though they arises from the thoracodorsal fossa and iliac crest part, they will not forms, they are not connected in this area. Only they are connected. Which part? That means which other part of these two muscle arises from this external oblique groove of the external oblique muscles. That means from this area. First, we have to divide it into three halves in this area: lateral half, middle half, and medial half. These three halves. So from this entire three half, only the medial, lateral, not medial, the lateral two half parts. This from this entire half part of the group part, the internal oblique muscle arises. Okay, again from the lateral one third part, internal oblique muscle. This one is the lateral 2/3, and transversus abdominis from the lateral 1/3. They will arises. They will goes upward like this step. In another picture, I'm going to try. They will go upward, and when they arises from this part, their direction will be towards the pubic crest, and towards the pubic crest, and over this one in the linear elbow part, they will insert it. So when they are going, their first direction is upward and medially, because they have to come to the medially. Their direction is the upward and medially, then backward and medially, and downward and medially. So when these two muscles come downward and medially, at that time they become joined, these two muscles, and at that time they are known as the conjoint tendon. Okay, this concept you have to know. Now we can say the boundaries of the canal. See, so here the anterior wall, entire part of the anterior wall is formed by, first you will get when you go from the superficial to deep. First entire part is skin, then after that you will get definitely superficial fossa, then the external oblique muscle. That means these three things will become in the entire anterior area. Anterior wall will be formed as skin, superficial fossa. Again partially lateral 1/3. That lateral 1/3 part of this canal is formed by some fibers of the internal oblique muscle also, but not in this area, transversus abdominis. So it will not comes. So what is the things that forms the anterior wall? You have to say skin, superficial fossa, aponeurosis of the external oblique muscle, and also by the internal oblique fibers. Now come to the posterior wall. In the posterior wall, what happened? It's entirely formed by the fossa transversalis. You know, this just behind these three muscles, there is the fossa, and this fossa is known as the fossa transversalis. So behind all these things, you will get the entire part is the fossa transversalis, which separates the canal from the extraperitoneal tissue and the peritoneum. So the posterior wall, the medial half, they will form the conjoint tendon. We have give the concept when they goes this way. Only in the medial half, they form by the conjoint tendon, which lies always in front of the fossa transversalis. And medial 1/4 part, reflected part of the inguinal ligament. When you have to know, when it comes, there is one reflected part of the inguinal. When it comes to the pubic tubercle, one reflected part of the inguinal ligament goes this way, which goes this way towards the linear elbow. Okay, so that's why these are the things in the posterior wall. So posterior wall, you have to say, one is the entire part is the fossa transversalis. Then second things, medial half is formed by the conjoint tendon also, and also 1/4 part is the reflected part of inguinal ligament. Okay. Now roof is very easy. Roof, only these things, these arc fibers of these two, when they going to form this word, these two fibers, they form, that means the internal oblique muscles and transversus abdominis muscle, they will form the roof. Floor also. In the floor, definitely this one is the groove, definitely is the groove that forms by this inguinal ligament, and where this posterior margin, they will definitely fuses with the fossa transversalis in this area, in this entire area. But in the medially, what happened in this area in floor is formed by lacunar ligament. You should know the concept of lacunar ligament. Just posterior to the inguinal ligament, there is one thing, you know, this pictures this picture, I hope you know. So in this area, what happened? This is the femoral sheath, the posterior layer and anterior layer. So in the femoral sheath, it contains 3 compartments. All these things you have to know. Then after that, 3 compartments. So middle one is the femoral canal. Just middle to the femoral canal, there is one deficient part, and there is one again extension of the inguinal ligament. I have already told you 3 extension of the inguinal ligament. One I have already told you, this one is the reflected part of inguinal ligament. One is the pecten pubis, which goes along with the pecten pubis part of the ilium bone. And then after that, this one is the triangular portion extension, medial side. This is known as the lacunar ligament. So this lacunar ligament also forms the roof floor, not roof, floor of the inguinal canal. So these are the things you should know when you make the concept about the inguinal canal. Okay, thank you.